DaTscan ioflupane 123 injection is a radiopharmaceutical indicated for striatal dopamine transporter visualization using SPECT brain imaging to assist in the evaluation of adult patients with suspected Parkinsonian syndromes, PS. In these patients, DaTscan may be used to help differentiate essential tremor from tremor due to PS, idiopathic Parkinson's disease, PD, multiple system atrophy, MSA, and progressive supranuclear palsy, PSP. DaTscan is an adjunct to other diagnostic evaluations. DaTscan was not designed to distinguish amongst PD, MSA, and PSP. The effectiveness of DaTscan as a screening or confirmatory test and for monitoring disease progression or response to therapy has not been established. Contraindications. DaTscan is contraindicated in patients with known hypersensitivity to the active substance, any of the excipients or iodine. Warnings and precautions. Hypersensitivity reactions, generally consisting of skin erythema, pruritus, have been reported following DaTscan administration. Thyroid accumulation. The DaTscan injection may cause up to 6% of free iodide I-123. To decrease thyroid accumulation of I-123, block the thyroid gland at least 1 hour before administration of DaTscan. Failure to do so may increase the long-term risk for thyroid neoplasia. Adverse reactions. In clinical trials, headache, nausea, vertigo, dry mouth, or dizziness of mild to moderate severity were reported. In post-marketing experience, hypersensitivity reactions and injection site pain have been reported. Drug interactions. Drugs that bind to dopamine transporter with high affinity may interfere with the DaTscan image. The impact of dopamine agonists and antagonists on DaTscan imaging result has not been established. Use in specific populations. Pregnancy. Radioactive iodine products across the placenta can permanently impair fetal thyroid function. Administration of a thyroid blocking agent is recommended before the use of DaTscan in pregnant women. All radiopharmaceuticals have potential to cause fetal harm. There is no available data on DaTscan use in pregnant women to evaluate for a drug-associated risk of major birth defects, miscarriage, or adverse maternal or fetal outcomes. Advise pregnant women of the potential risk of fetal exposure to radiation with the administration of DaTscan. Lactation, iodine 123, the radionuclide in DaTscan is present in human milk. There is no information on the effects on breastfed infants or on milk. Advise a lactating woman to interrupt breastfeeding and pump and discard breast milk for at least 6 days after DaTscan administration to minimize radiation exposure to a breastfeeding infant. Pediatric use. The safety and efficacy of DaTscan has not been established in pediatric patients. Geriatric use. There was no difference in responses between elderly patients and younger patients that would require dose adjustment. Renal and hepatic impairment. The effect of renal or hepatic impairment on DaTscan imaging has not been established. The kidney excretes DaTscan. Patients with severe renal impairment may have increased radiation exposure and altered DaTscan images. Overdose. It is unknown whether or not ioflupane is dialysable. The major risks of overdose relate to increased radiation exposure and long-term risk for neoplasia. In case of radioactivity overdose, frequent urination and defecation should be encouraged to minimize radiation exposure to the patient. Procedure. Radiation safety. DaTscan emits radiation and must be handled with safety measures to minimize radiation exposure to clinical personnel and patients. Prior to DaTscan administration, please read the full prescribing information for additional important safety information. To report suspected adverse reactions, contact GE Healthcare at 800-654-0118, option 2, then option 1, or the FDA at 800-FDA-1088 or www.fda.gov/medwatch.
Just to finish up briefly with a couple cases that I've referred for DaTscan, and the interesting thing from my standpoint about this is these patients are really just about the same age, in their mid-60s when we do see Parkinson's. However, one patient I just diagnosed really months before with a new onset left upper extremity tremor. We're just starting to get him on levodopa. And for comparison, I also included a 66-year-old man. Now he has a known long history of Parkinson's disease, and he's at a different point with motor fluctuations and dyskinesia alternating with severe off periods. So his treatment is more challenging, but I thought it's interesting to compare these scans.
Yeah, well, thanks, Scott. And it's always interesting as the nuclear radiologist to find out about these patients' history after I've reviewed the imaging. And these are really typical of what we see when it matches up, but you and I know that there's been some cases where it's just really left our head scratching, where patients just started with the earliest of symptoms and they have absolutely severe loss throughout their brain. It's just remarkable, and vice versa sometimes. The correlation to symptomology is good, but far from perfect, as we've seen over and over. Patients will always find a way to defeat your your correlation with imaging. But as you can see on this left-hand patient, the patient with the new onset left upper extremity tremor, you can see that there's decreased activity in that right putamen. It's nearly absent, at least severely decreased. And again, due to the crossing of the fibers, that's usually how it shows up. The tremor on the left side will result in more severe loss of dopamine transporters in the right stratum and vice versa. So that usually makes it, in one of our own retrospective studies, it was close to 80% or maybe even a little bit more. So again, just that right side being abnormal in the putamen is enough to call this scan abnormal and to give us the diagnostics accuracy. But this left side is actually relatively preserved. I mean, there might be the earliest loss happening in that posterior putamen on the left. As you said, as the disease progresses, you're eventually going to get bilateral abnormalities. Just to emphasize, that scan is not indicated for following up patients, but research not clinical use, but research use with patients with serial imaging have shown this to be as we expect from just looking at sort of a cross section of the population. And on the right hand side, we have the example of just really severe loss, one of the most dramatic examples of just elevated background levels of activity. And you have these periods here, but even these caudate are far below normal activity given this elevated background and just no activity in the putamen whatsoever. So just great examples of really the ends of the spectrum that you can get with abnormal data imaging.
Thank you. Yes, there are patients in our practice that have had very long run with Parkinson's disease, and they never had a DAT scan early on because it wasn't available. From time to time, we have reason to maybe order the scan at a later point when it's available. It's sort of nice just to know what to expect sometimes or what the spectrum can be.